Hi everyone, my presentation is on Trichinella canis, which is under tissue nematodes. So the presentation contents are pathogenesis and clinical manifestations, life cycle, laboratory diagnosis, treatment and prevention. Beginning of Trichinella canis is a parasitic nematode commonly known as roundworms that affects canines, including domestic dogs, wolves, and foxes. Trichinosis, which is also known as trichinellosis, is a disease which is caused by a species of roundworms called Trichinella. These parasitic roundworms are found in animals that consume meat, such as pigs, bears, foxes, and walruses. Moving on to the pathogenesis and clinical manifestations. Trichinosis is caused by the larva of the Trichinella roundworm. The parasitic worm is often found in animals that consume meat, such as pigs, which is one of the most common carriers of this parasite. So the animals get infected with Trichinella when they feed on the infected animals or the garbage that contains the infected meat scraps. Humans, they get trichinosis when they eat this raw meat or the undercooked meat from an infected animal. The pathogenesis. So after the parasites are ingested, the stomach acid dissolves the cyst, which is the protective capsule surrounding the larva. When the cyst is dissolved, the larva enters the intestines where they mature into adult worms and they reproduce. What are the symptoms of trichinosis? So when the larva is in your intestine, the symptoms you might experience are diarrhea, abdominal cramps, fatigue or low energy, nausea, and vomiting. And some of the symptoms that will be experienced when the larva enters your muscle tissues are muscle aches or pain, high fever, facial swelling, sensitivity to light, and persistent eye infections. Some of the rare complications of a Trichinella infection are encephalitis, which is the inflammation of the brain tissue, sinusitis, inflammation of the nasal passages, myocarditis, which is the inflammation of the heart muscle, pneumonia, where the sacs become inflamed, and nephritis, inflammation of the kidney. Moving on to the life cycle of Trichinella canis. So these domestic animals, they feed onto meat scraps and other thing and get infected with the Trichinella parasite, and then it is present in the encysted larva in striated muscle, which is ingested by humans in the form of undercooked meat, right? And then after exposure, it is released. The larva is released from the cyst, right? And then it invades into the small intestine where they develop into adults. From the small intestine, the larva is deposited in the mucosa, and then from there, they migrate to striated muscles where they encyst. Moving on to the laboratory diagnosis. Immunodiagnostic tests include enzyme immunoassays that detect Trichinella-specific antibodies. So antibody levels are not detectable until 3 to 5 weeks post-infection, well after the onset of acute illness. Antibody development is also affected by the infecting dose of larva. The higher the effective dose, the faster the patient's antibody response will develop. So multiple serum specimens should be drawn several weeks apart to demonstrate seroconversion in patients whose initial specimen was negative. IgG, IgM, and IgG antibodies are detectable in many patients. However, tests that are based on IgG antibodies are more sensitive. So the antibody levels peak in the second or third month post-infection, and then they slowly decline after several years. Moving on to treatment and prevention. How is trichinosis treated? So usually trichinosis doesn't require treatment because the infection resolves within several months after the onset of symptoms. However, the condition is often treated with medications to help manage the symptoms and prevent complications. Some of the medications prescribed by doctors include antiparasitic medicine that treats infection, steroids to help control inflammation, and pain medications for muscle aches. Right? These are albendazole or mebendazole. Together with treatment, there are some of the ways in which trichinosis can be prevented, and these are through avoiding eating horse meat, cooking meat properly before eating, cleaning meat grinders and utensils thoroughly before and after use, and washing hands thoroughly after handling raw meat. And this is the end of the presentation. These are some of the references which were used to come up with the ideas for this presentation. Thank you.